your levels were...
Dr. Oz was first to raise the alarm.
Some of the best-known brands in America have arsenic in their apple juice.
He was quickly shot down by our own Dr. Besser, backed by the FDA, which said arsenic levels were low, and that what Oz found was a mostly harmless form of arsenic.
Without getting those results confirmed by other labs, no good scientist would ever do that kind of work.
But today, new tests and fresh alarms. Consumer Reports tested 88 samples of juice and found 10% had arsenic levels higher than the government allows for drinking water. Not the harmless form, but mostly the dangerous form. And it's not just found in apple juice. They also tested grape juice. Actually, a large number of fruit juices list apple juice as their primary ingredient. Because of the sugar in juice, pediatricians already recommend that infants under 6 months don't drink any, and children under 7 drink no more than 4 to 6 ounces per day. But many children drink much more than that.
I would say that the typical kid definitely drinks more juice than water.
The FDA says it's confident in the overall safety of juice, but admits they found some samples with higher arsenic levels than they first revealed. Right now, the government has no standards for arsenic in juices. So we asked the industry today why they don't act on their own. Just to help parents breathe easier, rest assured that it's safe, why not just limit it yourself?
Arsenic is a naturally occurring element that occurs in trace levels in our food, our water, our air. Trace levels of arsenic are not a problem. Trace levels of arsenic are safe.
The juice makers say the government needs to set the standards, and the FDA tells us based on some of these elevated levels, they're considering doing just that.
And now, here together, side by side, our own Dr. Richard Besser and Dr. Mehmet Oz. Help us grasp at home, how serious is this? What does this arsenic do in the bodies of children?
Well, there's data on risks to cancer from long-term chronic exposure. I haven't seen good data on what is the impact of low-level long-term exposure in children. I think we need more information in terms of the risk of arsenic.
We believe that elevated chronic exposure to arsenic can cause heart disease. We know that it's associated with cancer, skin disorders, developmental delays.
Yeah, but I'm saying then why give them 4 ounces? Why give them 6 or 8 ounces, period?
Well, I've had these discussions with both the FDA and with the Juice Products Association. I've made that exact point. These are products that are supposed to be healthy for our kids. If we're not going to be able to assure them that they're safe, I'd rather you just have tap water. If you get those numbers down low enough, it becomes a safe beverage. Until then, the jury's out.
Arsenic is something that exists in the environment. It's in soil, it's in air, it's in water. But until you set standards, until you decide, okay, here's the threshold, and you start testing, you're not going to be able to see.
Make you mad you went into battle with insufficient, incorrect facts from the FDA?
What bothers me the most is that when Mehmet and I spoke before, the information I had from the FDA was incorrect. You were right.
Thank you very much. I appreciate it.